So we're going to begin Unit 4, looking at Chapter 13, which basically discusses the microbe and the human interactions. Now, if you recall, the last unit that we just discussed, Unit 3, we talked in Chapter 11 and Chapter 12 about how to control microbes, right? So we talked about how to control them with physical controls, as well as mechanical controls, and even chemical controls. And in Chapter 12, we looked at how to control them with chemotherapy or drugs. And so when we get to Chapter 13, what we want to kind of consider is what happens when we lose control. Like, how does that happen? How does infection and how does disease actually take place? And so if we go through this, we're going to first start off with some vocabulary words and then kind of move into the process of infection. So first off, we want to remind you we're not alone, right? The human body contains a wide variety of microbes. Remember, we learned this in one of our very first labs that we did on ubiquity, that microbes are ubiquitous in nature, which means they're constantly here. And so because they're constantly here, our bodies are in this constant state of balance and change. That's what it means when we say we're in a state of dynamic equilibrium, because we're constantly having to interact with the microbes that are here and keep them in check. And so some of the kind of vocabulary words that we associate, and this is that first objective that we associate with infectious diseases, are things like normal biota, infection, pathogen, and infectious disease. Now we're going to come back with a couple of objectives and talk about normal biota, so we'll come back to that term in just a moment. But if we look at infection, so infection is a condition where pathogenic microbes, now that pathogen is any agent that can cause infection, okay? Now, again, we're calling them pathogenic microbes because, remember, not all microbes are bad, right? Not all microbes have that ability to cause infection or cause disease. So those that can, in order to lead to an infection, they have to penetrate through the host defenses, they have to get into our tissues, and they have to actively multiply and spread. And so an infectious disease simply is an infection that has had that ability to penetrate the host, get into the tissues, start to reproduce, and then start to damage and disrupt tissues, organs, and their processes. So some terms that you may see as we kind of go through this thing as far as infection is concerned. Now, if we come back to that idea of normal biota, so first off, remember, normal biota, these are the microbes that are commonly found in or on our body. And if you go back to that first slide, some other names we have for these are indigenous microbes, microflora, normal flora, commensals. All of those are microbes that are typically found on or in our body. Now, as far as normal biota are concerned, they actually have some benefits. You know, there's some reasons why we want them here. They can help provide a protective, stabilizing effect to body surfaces, right? They're involved in the maturing of our host defenses. They help us to develop our immune system. But microbes can invade and they can actually cause disease. And so although we know that there are some benefits to having them, there's also some adverse things that we have to consider, is that when they're able to move into other parts of the body where they're not normal, where they're not supposed to be, that's where we see infection set in. Now, as far as the types of microbes that we see, microbes for our body, they typically fall into one of two categories. So we have what are called transient microbes and then resident microbes. And so, of course, transient, that word transient, it means to stay in a place for a short period of time. So transients are microbes that are simply passing through. You know, think about transient students. These are students that actually go to another university. They'll come here for a semester or come here for a class, but they're fully intending only to be here for a short period of time and then go back to their university. That happens a lot in our summer classes. So residents, on the other hand, these are microbes that are going to have your body as their place of residence. So if you're going to send them mail, you would send it to your body because they're planning on establishing themselves and staying for an extended period of time. But either category they're in, as long as the microbes stay in their normal environment of your body, things tend to be okay. But if they're able to get into other areas, that's when we see infection set in. So one of the things that we see with microbes as we mentioned, is that, again, we have normal biota. These are microbes that are commonly found on or in parts of our body. And so we'll look at a quick list, and this is a table that you can find in your textbook towards the beginning of the chapter. So this is on like page 400. These are some of the sites that normally have resident microbes on it. Now, so you see the skin, you see the upper respiratory tract, the GI tract, the opening of the urethra, external genitalia, vagina, ear, canal, and then the external eye. And so if you look at those, one thing that everything on that list has in common is that all of these places of your body at some point interact with your external environment. So it makes sense that since they have openings to the outside of your body, it makes sense that they're going to come in contact with microbes, and so there would be microbes there. So these are common areas where you typically find normal biota. Now again, some things that can kind of fluctuate health in regards to resident microbe. We know that age can play a role in the growth of microbiota. Diet, the things that you eat, can play a role in the amount of microbes that are normally found in your body. Hygiene, hormones, drug therapy, all of those are factors that can play a role in influencing the growth of microbiota. Now, again, we mentioned there's a benefit to having them there because there are some microbes that can prevent other growth of other microbes. We call it microbial antagonism, where the normal biota actually fights off the stuff that's not normal. But again, when the normal flora is introduced into an area that they shouldn't be in, they lead to what's called an endogenous infection, which means an infection that you didn't catch from somebody else. You developed this infection with the microbes that were already present inside of your body. Now, when we think about areas of your body that should be sterile, there's another table in your books. Table 13.2 is on that same page 400. These are some of the areas of your body that we would consider to be sterile. Now remember, that word sterile from the last unit, it means free of all microbes. So look at the list. We see heart, circulatory system, liver, kidneys, bladder, lungs, brain, spinal cord, muscles. All of these are internal cavities, internal organs that are not directly exposed to your external environment. And so because of that, we would assume that they are sterile. Now, that does not mean that they always stay sterile. But in order for you to stay healthy and not have an infection, they need to be sterile. So some pretty important things to mention there. Now, they mentioned the term actinic. So actinic, another word for sterile, right? So it means free of all. So here's some fluids that we assume would be actinic. So you got blood, urine that's in your kidneys, your ureters, your bladder, cerebrospinal fluid, and then of course they mentioned saliva and semen prior to entering into their canals or their cavities. Now again, that does not mean that these are always actinic or sterile, but in order for you to stay healthy, they need to be. So, of course, one of the things that we wanted to mention here is that normal biota is important. Again, it plays a very essential role in maintaining our health. And so we need to be really, really careful in taking care of that flora. And so be mindful, if you take an antibiotic, we talked about this in chapter 12, antibiotics are anti-life, right? They're going to seek to kill any kind of microbe that's in your system, even the good stuff. And so that's why a lot of times when you're on antibiotics, you will typically associate those with some digestive problems, right? So you may experience constipation, you may experience diarrhea. And so what a lot of doctors will tell you is that if you'll also take probiotics while taking the antibiotics, probiotics will introduce microbes back into your body that are there to help maintain normal levels of digestion, normal levels of just health. So definitely something that's important to remember with those. So just a quick check for you at the end of this section.